So in this video we are going to talk about myotomes and how to check the cervical spine myotomes. So start with myotomes. What is myotomes? So myo stands for muscle and tome stands for a section or a volume of muscles. So myotome is defined as a group of muscle fibers supplied by one spinal segment or one spinal root level. That is defined as a myotome. Myotome examination is very important part of neurological examination in case of radiculopathy. Myotome examination is difficult compared to dermatomal examination because each skeletal muscle is supplied by more than one spinal root levels. Myotome is a part of a somatic nervous system, and somatic nervous system is again a part of a peripheral nervous system. So, how you check the cervical spine myotomes? So isometric contraction is given to resist a movement. Now before that we'll see, okay, what is isometric contraction? So iso stands for same and metric stands for length. So when a patient contracts any muscle isometrically, the muscle is getting contracted without any change in the length of a muscle. Myotomal examination where both sides are tested to compare the strength at the same time on both the sides, left and right. 5 seconds of isometric contraction resistance should be applied to rule out any weakness at a neurological level. And force must not apply to the joints or over the joints by the examiner's hand, because if the joints are already tender or painful, it may mask your examination. Starting with this, so now we start with the cervical spine myotomal examination. So first is neck flexion or C1, C2 myotome. So the patient is in a sitting position. Examiner applies a counter force, one hand on the forearm to resist the neck flexion, and the other hand should be applied or should be placed between both the scapulars of the patient to stabilize the trunk to resist neck flexion. Not too much force should be applied that the neck will go into extension. Now coming back to neck side flexion. So neck side flexion, myotome C3 in cranial nerve 11. So examiner place one hand, that side should be tested. So one hand just above the ear and the other hand on the opposite shoulder to stabilize the trunk and check for side flexion. Compare on both the sides. Next is shoulder elevation. So shoulder elevation checks for C4 myotome and cranial nerve 11, where an examiner applies a downward pressure to both the elevating shoulders. Shoulder should be elevated from almost half to full range of motion to check any weakness at the particular myotome level or C4. In that, care must be taken that if the patient is in a sitting position, patient should not or must not brace his or her arms against his own thighs. So the patient shouldn't get a momentum to elevate the shoulders. Coming back for C5 myotome. C5 myotome is shoulder abduction, where the patient's arm should be in a abduction about 75 to 80 degrees in the scapular plane, elbows flexed to 90 degrees and forearms pronated. Examiner applies a downward pressure to the both humerus, and care must be taken that patient should not rotate, or in order to prevent the rotation, examiner places his or her forearm on the patient's forearm to prevent any rotation. Coming back to the C6 myotome. So C6 myotome is elbow flexion and wrist extension. So patient's arms by the side. In order to check the elbow flexion, examiner applies a downward isometric force to check the elbow movements. Now coming back to the wrist movement. So wrist movements can be checked by flexion, extension and ulnar deviation. So in this C6 myotome, wrist extension should be checked. So examiner applies a downward isometric force to check the wrist extension. Coming back to C7 myotome. So C7 myotome is elbow extension and wrist flexion. So to check the elbow extension, examiner applies an upward isometric force, arms by the side, and to check the elbow And to check the wrist movement, so wrist flexion, examiner applies a downward isometric force to check the wrist flexion movement or to resist the wrist flexion at C7 myotome. Coming back to C8 myotome. So C8 myotome stands for thumb extension and wrist ulnar deviation. So starting with the ulnar deviation, examiner stabilizes the patient's forearm with one hand, and to resist the movement of ulnar deviation, examiner applies the counter force in a radial deviation direction. And in order to resist the elbow extension movement, examiner applies the counter force in the direction of elbow or thumb flexion. Coming back to T1 myotome. So T1 stands for hand intrinsics. So abduction and adduction, or adduction or abduction. So in order to check the adduction, examiner can place a piece of paper between the fingers and pull to check the force, how much patient is applying for adduction movement, or in other words, even examiner can place his or her fingers and ask the patient to adduct how much force a patient can apply. In order to check the abduction movement, the examiner isometrically applies the force in adduction movement. That's T1 myotome. Thank you.